Hey guys, today I want to talk about gastrointestinal diseases. Now, when we talk about gastrointestinal diseases, we basically refer to diseases involving the gastrointestinal tract, right? Namely the esophagus, the stomach, the small intestine, and the large intestine. And also don't forget our accessory organs, right, of digestion, which includes the liver, the gallbladder, and more importantly, the pancreas, right? Don't forget that that's part of the GI system too. Now, let's talk about a few diseases that we might encounter in our exam, and that would include Crohn's disease and ulcerative colitis. Now, those two are major NCLEX diseases, so make sure to take note of that. Okay? Now, let's begin and go over Crohn's disease. Now, with Crohn's disease, it's what we call an inflammatory bowel disease or IBD, right? Now, what it basically means is that it can affect any part of the gastrointestinal tract from the mouth all the way down to the rectum. But with this disease, it specifically usually affects primarily the small intestine or the ileum, right? Now, now the symptoms with our patient can include abdominal pain, and this is very important because what do you know what the reason is for this pain? Basically, it's due to the inflammation, right, of the lining within the digestive tract, which obviously can lead to abdominal pain. And keep in mind, be mindful that this inflammation can also lead to severe diarrhea, which can be bloody, right? And with all these complications, it leads to fatigue and weight loss to our patient. Therefore, the symptoms, like I mentioned before, can include abdominal pain, right, due to the inflammation. The patient can also have severe diarrhea, which can be bloody, and the patient will be fatigued and can have some weight loss. Okay? Now, remember when I mentioned that it affects primarily the small intestine or the ileum? Now, this basically means that the pain would then be manifested as a lower right area abdominal pain in our patient, right? Again, since it affects most commonly the small intestine or the ileum, therefore a major symptom for a patient with Crohn's would therefore be a lower right area abdominal pain. Okay, so make sure to take note of this because this can be very important information for your NCLEX exam. Now, there are no medications or surgical procedures that can cure Crohn's disease. Okay, I repeat, there is no medications or surgical procedures that we can do to cure our patient with Crohn's, but there are treatment options. Okay, there are treatment options that can help alleviate or lessen the symptoms and hopefully maintain remission and hopefully prevent relapse in our patient. Now, important treatment information that you have to know would include giving your patient anti-inflammatory agents or basically anti-inflammation drugs, right? Now, the goal of this treatment is obviously to control inflammation, right? Since less inflammation leads to a relief in our patient's symptoms such as the abdominal pain, right? Which can hopefully decrease the diarrhea and the rectal bleeding too. Now, a common drug that you might encounter in your exam would be sulfasalazine, right? And again, it's an anti-inflammatory agent. And the side effects can include nausea and vomiting and some gastric distress. And this is because it does react with the stomach lining with our patient, okay? Now, corticosteroids such as prednisone can also be given to our patient. And corticosteroids in relation to Crohn's, what it does is it basically suppresses the immune system, and the immune system responds in the body, which in some way plays a role with the inflammation. Okay, now I will go over other important topics and other diseases in the next few videos. Now, I want to thank you so much, guys, for spending your time. I really do appreciate it, knowing that you have learned something that can help you hopefully pass your NCLEX. And if you do feel that you want to help support me with continuing doing these videos, just please visit me in my website at www.allnursingnotes.com. Again, that's www.allnursingnotes.com, and there's an NCLEX course in there that's available that has helped hundreds and thousands of NCLEX takers pass their exam. And again, thank you so much for your time. I wish you the best of luck in your exams. I know you will do great. Thank you and God bless. Bye bye.